Our next speaker, final speaker for this panel, is Dr. Miyoung Chun. She is the Executive Vice President of Scientific Programs at the Kavli Foundation. She began her academic career as an assistant professor of biochemistry and a member of the Whitaker Cardiovascular Institute at Boston University School of Medicine. She then worked as a scientist and project leader at Millennium Pharmaceuticals. But before joining the Kavli Foundation, Dr. Chun served as an assistant dean of science and engineering at University of California, Santa Barbara, serving the California Nanosystems Institute in particular. There, she was also appointed the Director of International Research Advancement, playing an active role in building partnerships among academia, government, and industry. Welcome to you, Dr. Chun.
Thank you very much for the invitation. And as an immigrant of this country and now U.S. citizen, I'm really honored to be speaking at Presidential Commission. The Kavli Foundation's mission is to advance science through science programs, and we support research activities through our Kavli institutes and professors. It's an international foundation where we have 17 Kavli institutes around the world, 11 in the US, 3 in Europe, and 3 in Asia. We focus on 4 fields: theoretical physics, astrophysics, nanoscience, and neuroscience. We also have science programs that are all revolving around different meetings, collaboration with the academy, and we have collaborations with scientific societies at their annual meetings. And we have our own meeting program, Kavli Future Symposia, and we have our own meeting place, which is called Kavli Royal Society Center. I mention all these different programs that we have because we think that the Kavli Foundation played a very critical role in developing the BRAIN Initiative through utilizing all of our Kavli programs through our meeting site where first idea to have this BRAIN Initiative had come, and so on. So I wanted to mention that. And through those activities, of course, in April 2nd this year, President announced a BRAIN Initiative as the next great American project. He emphasized this initiative is for providing scientists the tools that they need to make difference in brain research. There are more than 600 diseases in the nervous system, and it's a vast number of diseases going from ALS, brain tumors, to epilepsy, variety of different memory disorders, multiple sclerosis, Parkinson's, and stroke. I'd like to actually mention a comment by Tom Insel, who's the director of National Institute for Mental Health, that it's known that there's a huge decrease in death rate among heart diseases, 63%, due to its better early detection. But that's not existing in many of the nervous system diseases. So this is something that I think we should really remember, that many brain disorders not only have cure, but also hardly any treatment. So this is a huge conundrum. And I wanted to, instead of giving laundry list of different stories that I'm hearing from among the scientists who work at the Kavli Institute, I thought that I will showcase about 3 different specific issues, ethical issues that's much more pertinent to the BRAIN Initiative and perhaps this commission. President Obama mentioned during his State of the Union, when he mentioned BRAIN Initiative for the first time, he mentioned that it will be important for this initiative to really tackle and help difficult diseases such as Alzheimer's. Alzheimer's disease has had great intense research period past 20 years, and yet given such a good results out of research, about $1 billion worth of clinical trial led to no effective drug treatment. And the current thinking is that the reason that we had not been successful in those drug trials is because we were treating those patients too late, that early intervention is going to be very important. Major stumbling block for that is the absence of tools to reveal the first expression of this disease. we know a lot about what's called macroscopic and microscopic changes in this disease. But what we really need and what we think that we can gain out of brain initiative effort will be to get better imaging capacity, understanding what's called mesospecific scopic brain circuitry change observation. And these advances are going to make big difference in understanding this disease. It will help providing better biomarkers so then we can detect disease much earlier, perhaps even before it happens. And then also we can use that for drug trials so then we know if our drug is working or not. So those are great things about what brain initiative can do for Alzheimer's disease. But things are much more complex than just that. So I want to talk a little bit about scenario here. And that comes from this picture where there's a mother who is 82 years old, and she's taking care of her daughter, Maria, who's sitting on the bed here, who's 61 years old, and her son, who's sitting in the other room, who's 55 years old. Another son who's 50 years old, who's not showing. And so she's taking care of 3 middle-aged children. What's wrong with this picture? 82-year-old elder is taking care of her middle-aged kids. It's the story of this Colombian family, where they are the world's largest family to experience early onset Alzheimer's, extended to over 5,000 people who live in very tucked away mountain area in Colombia. They have early onset Alzheimer's disease by having very specific gene mutation. And so then here is an example where you know how to depict who's going to get Alzheimer's at the age of 45. It's this deadly, very terrible disease. But problem is that there's no treatment. So then ethical issue here is then to diagnose those people or not. And so I can also mention some personal stories about those patients and how they see whether they should be diagnosed or not. But because of time constraint, I'm going to move on and talk a little bit about next step. And that is good news for this family now is that there are preventative treatment drug trial. And who could be better than this group of people whom we know already who's going to get Alzheimer's disease and when. So good news is that there are clinical trials called Alzheimer's Prevention Initiative, where 300 of these family members are involved in clinical trial, and some of them are as early as 30 years old, and they're going to now be treated with specific monoclonal antibody drug from Genentech, and NIH is actually supporting this endeavor for the next 5 years. Problem here now then is another ethical issue, knowing that majority of these participants already do know that they will get Alzheimer's at a certain age. Should we now then use them as a placebo? So these are the kinds of, I think, ethical issues that we should be very conscientious about. Another issue that I want to briefly mention is that in brain initiative, I think that neurotechnology will play extremely important role, and good example is deep brain stimulation, where patient that you see here is a woman who has had a stroke for the past 15 years and couldn't move at all. But here now, her having the small chip in her, deep in her brain, and it can now then make her think, and in doing so, she can move this robotic arm and drink her morning coffee. And this is first time that she was able to drink her coffee, and look how happy she is. This is just remarkable how small stimulation, numbers of neurons in entire brain can make this unbelievable effect on patients. Having said that though, if you look at her top of her head, she has to have this large probes on her head, and behind her is huge stack of computers. So we hope that through Brain Initiative that we will have such patients now sitting in his own kitchen, drinking a water or a coffee or whichever beverage of his choice, by having very small sort of instrument, and then having the computer size on his belt for like iPhone. These are great possibility and the real reality that can be possible with Brain Initiative.
we really need you to wrap up.
Yes, this is my last slide.
Good, thank
the
you.
problem is that these kinds of activities are perceived in public as manipulating your brain. And I'll just mention this one YouTube commercial that I was seeing on the way here in the airplane, and that is, here's a scenario where surgeon is manipulating his own patient and trying to do what he hopes that he can conceive. And so these are the ethical issues that we should be, I think, very aware.
Thank you.